So today we're going to be going over lesson 5, and this is the introduction to laboratory administration. So the first thing we're going to go over is the terms. So anemia is a decrease of certain elements in the blood, especially red blood cells and hemoglobin. Next thing we're going to go over is fecal occult blood testing, also known as FOBT. This is also known as the Guaiac test, and it is a test for blood that is in urine or feces. And this test will yield a blue color if blood is present. Next thing is hematology. Hematology is a medical specialty that pertains to anatomy, pathology, symptomology, and therapeutics related to blood and blood-forming tissues. Next is hematochezia, and this is the passage of bloody stool. So if you got some shit that's bloody, that's hematochezia. Next we have hematuria, which is the presence of blood or red blood cells in urine. Next we have hematocrit, and this is the ratio of volume of red blood cells to the total volume of blood, as determined by the separation of red blood cells from the plasma, usually by centrifugation. Next we have hemoglobin, and this is the red respiratory protein which transports oxygen from the lungs to the tissue where the oxygen is readily released. Next is ketones. So if you have diabetic ketosis, if you're pregnant, if you just went through a period of starvation or reduced weight, then you might have ketones in your urine. And that indicates that carbohydrate supplies in the body are going down and that body fat breakdown is occurring. Leukocytosis. If you have leukocytosis, that means that you have an abnormally high amount of leukocytes. So if the amount of white blood cells circulating inside of you are abnormally low, then you have leukopenia. So blood, usually when it dries, it gets darker and darker, and when that's in your feces, that can make the feces darker too. And this is known as melena or melena. A nitrate is a salt of nitrous acid. So occult is blood in the feces that is so small you can't see it, but it's detectable by chemical tests. Renal, and renal means that it's related to, affecting, or somehow involved with the kidneys. Specific gravity is the density of a solution compared to an equal volume of distilled water. Now we're going to go over common abbreviations that relate to specimens. CNS, culture and sensitivity. CBC, complete blood cell count. HTC, hematocrit, hemo or hemato, blood. HGB, hemoglobin. Nephro, kidney. PSA, prostate specific antigen. RBC, red blood count. RPR is rapid plasma reagin. UA is urinalysis. UR/O is urine. Urea is the presence of substance in the urine, and WBC is white blood cell count. There's two types of handwritten forms you need to remember. There's SF545, which is the laboratory report display, and then there's SF46-557, which is laboratory report request and results. So if you're gonna do a handwritten one, then you need to make sure that everything is in black ink. These notes need to include the patient's full name, family member's prefix, the sponsor's social security number, the rate, rank, status, branch of service, requesting the provider's name, the date reported, and the time of collection.